local influencers, like we can use the village leaders, sarpanch, and we can use the gram pradhan, we can use the spiritual leaders, like in Uttar Pradesh, the village adoption where we have done. One of the spiritual leader of that locality has given his ashram for running the centers there, and at the same time, whenever we do some activity in the village, we always involve the gram pradhan and sarpanch in our team so that people listen better to them. So lifestyle intervention should discourage consumption of refined sugars and processed carbohydrate while promoting traditional healthy diet. It's not necessary to celebrate each and every event with the sugary items. Culturally appropriate dietary recommendations are important. Not going into the details because of the paucity of the time. Improving medication access and affordability can be done by the help of the government and government subsidiaries, which are already in the process. But what we can do with the public-private partnership, what we can do with the non-governmental organization and our organization like kind of the RSSDI. Affordable access to the diabetes medication, insulin is crucial for effective management. If we can really help them, reaching to them, to every beneficiary, it could be the most needed things to be done. Enhancing monitoring and follow-up, that is by the mobile health solution, implementing the SMS-based reminders and mobile applications for medication adherence, telemedicine use as I already discussed, peer support group, like establishing the local diabetes support groups where the patient can share experiences, exchange knowledge and motivate one another to maintain healthy habits and treatment adherence. Regular monitoring and follow-up are essential, and that can only be encouraged by using all these things. Leveraging policy support, integrate with national program, incentivize the healthcare workers by one way or another way. Data-driven approach, develop a national diabetes registry for rural India to monitor disease trends, evaluate the effectiveness of the interventions and inform future policies which are based on the real world outcome. Policy support is crucial for creating sustainable improvement in rural diabetes care, and RSSDI kind of the organization help the government by creating those policies, by integrating diabetes management into existing health program, incentivizing the healthcare workers and adopting data-driven approaches. Policymakers can maximize the impact of the limited resources and ensure that interventions are targeted and effective. But for that purpose, RSSDI should be very much active in collecting the data, getting the data from across the country to help making the policies. Community engagement strategies, which village health community, health-focused community event, school-based program, trusted leaders involvement, technology-enabled solutions in the form of the digital health records, AI-assisted screening could also be helpful here, and addressing the gender disparities. In India is known for the gender disparities, and we need to help the population, supporting the women specific challenges, especially in the diabetes. Women diabetes is very much different to handle, and a lot of things are there which are required to be taken care when we are looking for the control of diabetes in a women. So we should be more and more empowering female caregivers, and we should be more careful about the women-led initiatives and women-specific challenges. Addressing diabetes in the elderly rural population, again, this population is increasing in nowadays in our country. Now, life expectancy has gone up in our country, and we can see that a lot of people are having forgetfulness, Alzheimer's in the end of their disease, and they are to be treated in very different, and they are not staying with their families, they are staying alone. So integrating traditional and modern medicine could be very much helpful here. Evidence-based traditional practices, combining with the collaborative care models, where we can see that traditional practices should be combined with the modern medicine, like I discussed sometimes back in Dr. Mohan's meeting about the functional foods. If we can take up the help of the functional food combining with the modern medicine, it can definitely help our people keeping more and more healthy, and can help in the prevention also. So conclusion, the path forward could be the urgent public health challenge to be taken care of very seriously, and this diabetes care in rural India remains a significant public health challenge requiring long-term sustainable intervention tailored to the unique needs of the rural population. The increasing prevalence highlights the urgent need for improved screening screening, early detection and accessible treatment options, region-specific strategies to be made across the country, because everywhere the diabetes is not the same across the country, and collective action is required. The future of diabetes care in rural India depends on the sustained effort in innovative healthcare delivery model, and collective action forms both and public and private sectors, ensuring that no community is left behind in the fight against diabetes. So by working on these three parameters, I believe in next few years RSSDI would be contributing to the diabetes population of the country in very positive manners, and probably we could be able to reduce the increase in prevalence of the diabetes, as well as we can stop a lot of our population going into the complication. Thank you very much for your kind listening.
So thank you. We are running short of time. Thank you. At the outset, I would like to thank all this greatest session of this conference, Dr. Professor Vijay sir and Mohan sir and Anuj sir. Thank you. Any questions in the audience? And over the Rajendran sir, any questions?
Thank you, Dr. Anuj, for having highlighted the problems faced by the rural people with reference to the number, with reference to the socio-economic status, with reference to the diagnostic inadequacies, and with reference to the management deficiency, and with reference to the follow-up. And over a period of time, I think that the scenario is getting changed with reference to the lifestyle in the rural area. In no way they are inferior to the urban areas, because the logistic improvements have occurred, and the things is totally different in the villages nowadays. Even the socio-economic status, their per capita income is also has increased. In this juncture, I would like to point, because you have elaborated that is the role of the private public partnership, and what is your plan as a president-elect to do it on behalf of RSSDI, how to counter the increase in the number of the diabetics. Already in the state of Tamilnadu, that is, they are having a program called Makkalai Thedi Maruthuvam. That is that the people, the government goes to the doorstep of the peoples. They deliver the anti-diabetic drugs and anti-hypertensive drugs for 1 month free of cost. Number two, our healthcare personnel, they also periodically go to the people and check that the blood pressure and that the blood sugars by that the glucometer. With this, according that is, of course, this is being happening for the last couple of years. Certainly there is a decrease in that the complications. At least we are not able to decrease that the incident. At least we have decreased that the complications, because as you said, that is RSSDI combines with that all that the state government. Of course, your dream will come true. The date is not very far away. Thank you once again for your elaborate lecture. Thank you very much.
Thank you, chairs, Dr. Rajendran and Dharmarajan sir.
We are not really going to free medications to be implemented in this project, because free medication gives an idea to the beneficiaries that their health is our responsibility. They should understand that their health is their responsibility. We should try to reduce the expenses of the monitoring. We should try to reduce the prices of the medicines. We can try to make them available at some low price store, but it should never happen that we should give them free of cost. If you give them the free of cost, sometimes if your supplies did not reach and it has been delayed even for 1 week, people won't take the medication for that 1 week. They will wait that after 1 week, once it will come, then we'll take. So keep remember that at the same time we should also generate a self-reliance among the population of our country, because now such a big population is going to be diabetic in the coming future. 35% has already suffering with the hypertension for which you are talking about. How can you make the 35% people dependent on the free medication or some subsidiary which is either coming from the government or coming from some NGO or something like that? We should support, we should make them a self-reliance feeling in them, that we should, our disease, we need to control, we have to do something for that. It is not the responsibility of the doctor or NGO or government.
Thank you, sir.